All right, so this is part 2 of the mobility and immobility learning module. And now we're looking at implementation of interventions to prevent complications related to immobility. The body needs protein to repair damaged or injured tissues and to rebuild any depleted stores. Vitamin B is needed for skin integrity and wound healing. It will be important to turn, cough, and deep breathe the patient often to assist in lung expansion and airway clearance. Chest physiotherapy consisting of percussion and positioning will clear airways and help prevent pneumonia. Implementation of interventions to prevent complications related to immobility. Immobilized patients have an increased workload on the heart, can experience orthostatic hypotension, and can experience thrombus. It will be necessary to assist patients with active and passive range of motion exercises to decrease the incidence of hazards of immobility. When applying sequential compression devices, this skill can be delegated to a nurse's aide. The nurse is still responsible for assessing circulation in the extremities. Do instruct the nurse's aide to notify the nurse if patient complains of leg pain and if discoloration develops in the extremities. Applying anti-embolytic elastic stockings. Again, the nurse can delegate to the nursing assistive personnel the skill of applying anti-embolytic elastic stockings. Before delegating, instruct the nursing assistant to inform the nurse if patient complains of leg pain or swelling or has any skin irritation. Instruct the nursing assistant to direct the patient to avoid activities that promote venous stasis, to elevate the legs while sitting, and before applying stockings to improve venous return. Not to massage the legs and to avoid wrinkles in the stockings. As the nurse, you need to observe for signs and symptoms and conditions of patient skin that contraindicate the use of anti-embolytic elastic stockings. Signs and symptoms include dermatitis or open skin lesions, a recent skin graft, decreased circulation in lower extremities as evidenced by cyanotic, cool extremities, gangrenous conditions affecting lower limbs. Also assess and document conditions of patient skin and circulation to leg and foot. Check for the presence of popliteal and pedal pulses, edema, and discoloration of skin. Checking temperature, lesions, or abrasions. Obtain a physician's orders before applying the stockings. And assess the patient's understandings of application of anti-embolytic elastic stockings. Implementation of interventions to prevent complications related to immobility. You need to reposition every 2 hours and provide skin care to the patient to help prevent pressure ulcers. Patients need between 2,000 and 3,000 milliliters of fluid per day to help prevent renal calculi and urinary tract infections related to immobility. Monitor intake and output to ensure that fluid balance is maintained. People who have a tendency toward depression or mood swings are at a greater risk for developing psychosocial effects during bed rest or immobilization. Anticipate changes in the patient's psychosocial status and provide routine and informal socialization. Observe the patient's ability to cope with restricted mobility. Nurses provide stimuli to maintain a patient's orientation. Plan nursing activities so the patient is able to talk and interact with staff. Involve patients in their care as much as possible. Ideally, immobilized patients continue normal development. In the care of the child, you do want to ensure adequate developmental opportunities of the musculoskeletal system in children with prolonged immobility. Nursing care needs to provide mental and physical stimulation, particularly for a young child. Patients with impaired nervous, skeletal, or muscular system functioning and increased weakness and fatigability often require help from the nurse to attain proper body alignment while in bed or sitting. Several positioning devices are available for maintaining good body alignment for patients, including pillows, positioning boots, ankle-foot orthoses, blankets, sandbags, hand rolls, and splints. A trochanter roll prevents external rotation of the hips when the patient is in the supine position. And the trapeze bar is a triangular device that hangs down from a securely fastened overhead bar that is attached to the bed frame. It allows the patient to pull with the upper extremities to raise the trunk off the bed. assist in transfer from bed to wheelchair, or perform upper arm exercises. This slide looks at different positioning techniques. In the supported Fowler's position, the head of the bed is elevated 45 to 60 degrees and the patient's knees are slightly elevated without pressure to restrict circulation in the lower legs. Patients in the supine position rest on their backs. The patient in the prone position lies face or chest down. And in the sideline or lateral position, the patient rests on the side with the major portion of the body weight on the dependent hip and shoulder. Sim's position differ from the side lying position in the distribution of the patient's weight. When looking at interventions to prevent complications, the goal of restorative care for the patient who is immobile is to maximize functional mobility and independence and reduce residual functional deficits such as impaired gait and decreased endurance. The focus in restorative care is not only on ADLs that relate to physical self-care, but also on instrumental activities of daily living. IADLs are activities that are necessary to be independent in society beyond eating, grooming, transferring, and toileting. They include such skills as shopping, preparing meals, banking, and taking medications. To ensure adequate joint mobility, teach the patient about range of motion exercises. When performing passive range of motion exercises, stand at the side of the bed closest to the joint being exercised. Perform passive range of motion exercises using head-to-toe sequence and moving from larger to smaller joints. If an extremity is to be moved or lifted, place a cupped hand under the joint to support it. Support the joint by holding the adjacent distal and proximal areas, or support the joint with one hand and cradle the distal portion of the extremity with the remaining arm. Walking also increases joint mobility. When a patient has a limited ability to walk, assess his or her activity tolerance to the upright position, strength, presence of pain, coordination, and balance to determine the amount of assistance needed. When evaluating, you do need to look to see, have the patient's goals been met? It's essential to have the patient's evaluation of the plan of care. Were the goals met, or is more work required? From your perspective as a nurse, you are to evaluate outcomes and responses to nursing care and to compare the patient's actual outcomes with outcomes selected during planning, such as his or her ability to maintain or improve body alignment, joint mobility, walking, moving, or transferring. Once these questions have been asked and you've addressed the limited mobility and its associated problems through the patient's eyes, you are prepared to adjust the plan of care to address the remaining clinical problems that your patient is experiencing in relation to immobility. Ensuring patient safety is an essential role of the professional nurse. To ensure patient safety, communicate clearly with members of the healthcare team, access and incorporate patients' priorities of care and preferences, and use best evidence when making decisions about your patient's care. It's important to mentally review transfer steps prior to beginning the procedure to ensure safety, assess patient's mobility and strength, determine the assistance needed, raise side rail on opposite side of the bed, arrange the equipment so it does not interfere or get caught, evaluate the patient's body alignment, understand and know how to use the equipment, and also educate the patient about how equipment functions to reduce their anxiety and help and obtain their cooperation. So this concludes the module. Thank you for your time.